While reading the paper at home, Sharon sees an ad placed by her podiatrist, Dr. Greiner. At Dr. Greiner's office, Sharon checks in and notices a copy of the ad on the check-in desk. She receives a questionnaire to fill out called, "Do you have PAD?" While waiting for the doctor, she sees a brochure on PAD and thinks she should learn more about it. She also notices a poster on the wall, or she'll talk to Helen, the nurse, when she comes to take her into the office.
Hi, Sharon.
Hi.
I see that you filled out your PAD questionnaire, and I just wanted to go over it with you. There are a couple of things on here that send up a little bit of a red flag for me. Out of the 8 questions, it looks like you circled maybe 4 of them that need some more attention, and I'm going to go through them one by one. It says something about having foot, calf, buttock, hip, or thigh discomfort when you're walking. Tell me approximately how far is it you can walk before you start having this pain?
About half a block.
Half a block, okay. And when you sit down, does the pain go away?
Sometimes it does.
Okay, great. Number 5 here, it talks about skin wounds or ulcers on your feet and toes. And you know, you're well known to me, and we've really struggled with that ulcer on your foot, haven't we?
Yes.
Well, thankfully it's closed now. Now we check your pulses every time, right? Okay. Have you suffered any injury to the legs or feet? You circled yes. Is that the time you went on vacation and sat on the airplane too long? Okay, I understand that. Okay, and I think that's about it. I would certainly recommend further evaluation. I'm going to recommend a PadNet Plus test for you. What we do is we do the test right here, and then we send the results or the data over to Dr. Ansel, who is a vascular specialist. He will get back to me with the results, and then we'll talk some more. Okay? Thank you.
Thank you.
Are you comfortable, Sharon?
I certainly am.
Okay. And some of the cuffs will blow up twice. You may feel some pressure, just like blood pressure cuffs they use at the hospital to take your blood pressure. A couple of them will go up twice. One's taking a waveform and the other is taking a pressure. Okay, Sharon, we're finished with your test today. Are you still comfortable?
Yes.
Okay. We'll send the test to Dr. Ansel. He will read and give the results to Dr. Greiner, and then they'll get together and discuss your care. Okay?
All righty. Thank you so much.
You're welcome.
Hi, Steve. I'm Dr. Ansel. Your family doctor sent you over because you were having some symptoms in your legs, and then they did some studies to look at pressures in your arteries or the blood vessels down below your hip, and they found that there was evidence that there was some blockage in there. So she wanted you to come talk to me about potentially getting that fixed. They already told me that they've tried medicines for a few months, and that didn't help very much, is what I hear. Is that correct?
Right.
Okay. And so now you're here to see if we can do something short of surgery of trying to get you to walk better. They said that the symptoms were pretty much limiting you during your daily activities. Is that right?
Right.
Okay. Well, this is hardening the arteries. We don't know exactly where the blockage is right now. We know it's below your hip. This is atherosclerosis. So it's going to be something that we can usually spread apart with a balloon or a stent or take out with some type of roto-rooter device we call an atherectomy to try to restore the blood flow to your leg. We'll also want to make sure that we have you on the right medicines afterwards, and make sure that you change your lifestyle, because this is a problem that may bother you the rest of your life. But
Hello, it's Dr. Greiner. Yes, Dr. Ansel.
I was giving you follow-up on a couple of your patients. First was Sharon. I saw her PADNET test, which shows extensive peripheral arterial disease.
Okay, I was afraid of that. She has an appointment on Tuesday. How about if I talk to her about that and we can send her over for further evaluation with you?
What kind of symptoms was she having? Yes, sir. Uh-huh. And you've already tried Playtol? Okay. Well, certainly I'd be glad to see her in the office and decide what we can do for her. Uh-huh, I'll be glad to. The next one I was giving you follow-up is Steve. Right, I saw him in the office already, and you're right. He's had extensive peripheral arterial disease on his study, and he's very symptomatic during his everyday activities. And he too, we've tried walking studies and Playtol through your office, and he's really just not responded. I do think it's time to go on to an angiogram to see if there's something we can fix interventionally short of surgery. Yeah, as a security guard, he really needs to be able to ambulate a lot better. Okay, yeah, I'll give you follow-up after we're done.
Okay, that's great. Thank you for your collaboration on this case.
Hi.
I'm glad you came back. I wanted to go over your PAD results with you. I'll get right to it. The bottom line is it looks like it's an abnormal test, and you do have some significant peripheral arterial disease in each leg. We have some waveforms here of the lower extremities. These are PVRs. You're a diabetic, and sometimes that can be a little confusing to certain tests. This test, however, is able to see through the diabetes and capture waveforms and gives us a true picture of your current state. So here on the right side we have pretty good waveforms, but they're a little dull. On the left, they're very dull. The bottom line is you do have significant peripheral arterial disease, and I would like to send you back to Dr. Ansel for some further testing and possible intervention. Do you understand?
Yes.
Okay.
And I wanted to see if you had any questions or anything about what we're going to be doing.
I'm good.
Okay.
When can we get it scheduled?
We can do it really quickly. We'll try to get you in the next day or two.
Good.